Hi, my name is Brian Corning. I'm the director of the Harvard Center for Comparative Medicine, and it's my pleasure this week to be hosting Voices from the Community. This week we'll be talking to two people who work in the Center for Comparative Medicine, and we'll be talking a little bit about what we've been doing during the ramp down and subsequent ramp up for COVID-19 here in Longwood campus. Joining me today are Kerri MacGillivray and Lindsey Lattinville, and I'll let them introduce themselves. Kerri?
So hi, I'm Kerri MacGillivray. I'm the animal care facility manager for two of the vivarium that are on campus. So I help oversee just the daily operations of those two facilities. And then we have another manager who oversees the remaining facilities. So we have a staff of animal care and cage wash technicians who do the daily work in those areas. And then we have a staff of supervisors who oversee that work, and then also to provide assistance to people who are doing research in those spaces.
Thanks, Kerri. Lindsey?
Hi, I'm Lindsey Lattinville. I've been with the Harvard Center for Comparative Medicine since 2006. I'm part of the vet staff. We tackle anything to do with animal health and well-being for all the research animals on the Longwood campus. We also help facilitate the work that the researchers do, making sure that they have the training, information, tools that they need to perform research safely and humanely. And my role as a vet tech involves a lot of hands-on assessing animal health and well-being and managing plans of care and treatments in coordination with our veterinarians.
Thanks, Lindsey. So Lindsey, compared to how it was before the ramp down and we were forced into some of the restrictions associated with COVID-19, how have you seen your job change and responsibilities change since that time?
Well, for the vet techs, it was a complete change to the way we do things. We transitioned from being on campus full-time to a sort of split schedule just to help us minimize the time that we spent on campus and doing work remotely when possible. So it was a new setup for us, but even though that framework had changed, what the animals needed from us did not. So part of our challenge was figuring out how to get those needs met, make sure the animals were healthy and well with all of these changes going on around us. For the department as a whole, we continued again to function throughout the shutdown while everything around us was changing drastically. The big turning point, of course, was when the labs shuttered in March. And I remember being in one of the facilities as the dust settled and looking around, and it was just empty. And there was a moment of, this is it. This is us now. And just sort of the weight of what the challenge ahead of us was just sort of settled in. I mean, our group, especially animal care technicians coming in every day faithfully to make sure those animals were cared for, they had to succeed. You know, we have precious strains of mice that are irreplaceable. We have studies in them that take years to complete. And it was certainly a shift to just think of us all of a sudden kind of facing that reality. And it was certainly a different mindset.
Thanks, Kerri. And Lindsey, excuse me. Kerri, how about from your perspective as the manager of the facilities and what you had to do differently during this time?
It's funny because Lindsey and the vet techs had to really change the way that they were doing everything, and then us on the animal care side didn't for a lot of it. Our charges, our animals, they don't care if there's a pandemic, they don't care if it's a holiday. So they're looking for the same care, regardless of what's going on. So we actually didn't change a whole lot of what we were doing. We were on campus every day. We were reporting every day. I think that if we had to consider what the biggest change for us was, it was just accessibility. So we were all here, but if we needed somebody else to come in, whether that be the people who were responsible for the animals who were here, so the people who were performing studies, the vet staff, if we needed them quickly, that they weren't here. So we had to kind of change how we communicated and make sure that we could get critical information to people who were not on site. So I think that was probably our biggest challenge, and making sure that we kept everyone included, even if they were not here every day.
Right. What came to you as one of the biggest surprises? We talked as a department, our own internal meetings about what we might expect or what might actually happen. Our job is to think of worst case scenario, unfortunately, and be prepared for it. What surprised you the most as to how it turned out the last couple of months compared to maybe what we thought going in?
All of us here, I guess all of our staff, I think that we were very fortunate. I think that we prepared for a worse case than what we actually faced as far as staff. We have a great group of dedicated technicians, and they were here. And I don't know how things would have looked if that didn't happen. I think that we tried to prepare well, so I'm really surprised that we didn't have to go to worst case scenario, that our staff was here every day. They were engaged the whole time, they were concerned. And then just how fast things change. We have a plan and we're going forward and we think everything is on track, and then we go off at a completely different, path, and really understanding how quickly we have to adapt to those changes. I think that was surprising too, just how fast everything was going to move.
Yeah, there was a period of time there where it seemed almost on a daily basis the guidance was changing, whether it was coming from the state or from the university or through the medical school itself. Required some really quick adjustments on the part of the staff.
Yeah.
Thanks, Kerri. Lindsey, how about from you? What happened or how did it play out differently than what you thought it might be going into it?
Well, as you've both already mentioned, sort of the quick pivots that were necessary sometimes just to get things done. And as Kerri said, our staff, very, very dedicated, seeing us through. I don't think it's exaggerating to say that they saved science. They were the ones who kept these mice going for the researchers as they come back. So one thing I did find surprising, even amid what could be a bit overwhelming and chaotic at times, is there were moments that I did find myself sort of enjoying the opportunity to sort of reflect on my job and how it's done, and sort of the reflection and innovation that can come with that. I think it was a pretty valuable step back to sort of consider where we are and how we go about things. But even that said, just like everyone else in the world, I am very happy to work towards the new normal and new routine, both here and at home.
Yeah, completely agree. So speaking of that return, how are things going for the ramp up? We're already going through some changes from what we were doing even a week ago. How would you characterize that?
Well, it's been great to see the researchers coming back, folks we haven't seen since mid-March. This is, another time of great change for us, figuring out how to accommodate all these folks safely. They're all very eager to get started. We're eager to have them back. We just need to figure out how to go about it safely, properly. This is also the first week I've been back on campus full time. So that's been, a new adjustment, even insofar as getting used to commuting 5 days a week. So I think we're doing the best we can. I think we're just going along, using those skills that we've learned over the last couple months of going with the flow and being able to pivot, and excited to welcome our lab staff back.
Kerri, how about from the manager's perspective? I know the scheduling has been a very big challenge. Could you talk a little bit about that in terms of the ramp up?
So it's an incredible undertaking. So, there are occupancy limits or guidelines for all of our rooms on campus, and there are many. And before, for people who aren't familiar with how we did things, before we would have, animal care, cage wash staff in these spaces working, and then investigators would come in. There would be often conversations between the animal care staff, veterinary staff, investigators would talk about what's happening in the room. Investigators would collect what they need, and then they would move on. And there was this kind of constant interaction. It was very collaborative. How are things going? Do I need to know about this? But now with these occupancy limits, we can't be in these spaces together anymore. And that's so hard.
You're limited to one person per room mostly, right?
Right. I think that there are maybe 3 rooms total out of all of our rooms where you can have, where it's only one person. And that's hard. So we have to work in these very strict time frames, and then trying to figure out when people need to access the room. Some of the labs are working in shifts, some are not. It's a challenge. And I think that we're all doing our best to find our way through it. I know, we have people who filled very specific roles within the department. And I know that, we talk to supervisors who then, they talk to me, and then I talk to somebody who's coordinating the labs. And it's really a giant group effort for all of us to be able to figure out how are we going to work in these spaces safely? How are we going to communicate to each other now that we're all on campus? And it's been changing. Some days, it's every day there's a new plan. I think that we're starting to level out, which everybody's looking forward to that, I can assure you. But we're getting there. I think it may take a bit more time, but we're getting there.
Yeah, I think the researchers have been really good to work with. Everybody's having to be very patient during this unusual period, obviously, and now trying to schedule everything into a shorter window of time to get our work done and their work done while we both can't occupy the room at the same time is really still going to be a big challenge going forward.
Definitely.
Sure. So thank you, Kerri and Lindsey, for participating in this week's version of Voices from the Community. And I hope you and everybody that you're working with, we all stay safe and stay well.